Hello, welcome to my frequently asked questions. Today I'm answering a commonly asked question about eyelids and blepharoplasty. What do I do if I have a small lump or bump, also known as an eyelid cyst, after having blepharoplasty? And in answering this question, we'll talk about, what are the causes of these lumps and bumps and cysts? What can be done in terms of treating these lumps and bumps? And finally, what can I do to ensure that I get the best possible result? My name is Dr. Julian De Silva, and I'm a London-based facial, cosmetic and plastic surgeon, and I specialize in blepharoplasty, and eyelid surgery is the commonest surgery that I complete for my patients on a daily basis. So in answering this question, first of all, what is the cause of these lumps and bumps after blepharoplasty? Well, occasionally, after having eyelid surgery, you can have a small lesion, a lump or bump, also known as an eyelid cyst, in the scar after having eyelid surgery. And the cause of this, there's lots of glands and that inside the skin that can make different kind of skin secretions, oily kind of secretions that have an important purpose in the face. And these are particularly common around the eyelids. And sometimes after eyelid surgery, one of these glands, rather than releasing the contents of the gland onto the skin surface, they can become trapped, and this essentially is a type of cyst. Now, 50% of the time, when these lumps and bumps occur, they can actually spontaneously resolve and treat themselves. But on occasion, these do persist and can require treatment. So what is the treatment for these eyelid lumps and bumps? Well, generally speaking, first thing to do is just to wait, because a good proportion, approximately 50% of these lesions, will spontaneously resolve without any treatment. However, on occasion, this doesn't occur, and it may be necessary to do something in order to resolve the cyst. What this would involve is putting a small amount of local anesthetic into that very focal area where the cyst is. That can sting for about 10 to 15 seconds. Then that little cyst is removed from the skin. It literally takes 2-3 minutes to complete that. I personally also use a little bit of cautery heat treatment to try and ensure that no further cysts occur in the future. And then a small amount of antibiotic ointment is placed on the surface. Generally speaking, the recovery from this kind of minor procedure is a matter of days, 5 days to a week. However, with any kind of eyelid procedure, there's always a small possibility of a bruise. And if you had any important events, it would be a good idea to allow a couple of weeks just in case of that small possibility of a bruise. Overall, these cysts happen in about 5% of patients, and they can be a little bit frustrating having lumps or bumps on the eyelid cysts, but these are very treatable. What can be done to prevent these cysts? Well, the cause of these cysts, partly is genetic, and some people have more of a tendency to have little cysts in the skin, and often you can find that you have little cysts elsewhere in the face. However, having had eyelid surgery, sometimes it can become more common. Generally speaking, most patients have one at most, but there's always a possibility of having two or more. Generally speaking, these cysts are not really an issue and can be readily resolved, and often even the appearance of the cyst is largely hidden because the scar is hidden within the skin crease with upper blepharoplasty. That makes it quite difficult to see the cysts unless it's towards the inside of the eyelid, towards the nose or the outside. But generally speaking, they're quite difficult to see and quite small. What can I do to prevent these cysts occurring? Well, part of it is genetics, and that is difficult to change. Part of the technique that's involved with upper blepharoplasty, there are certain things that can be done to minimize the chance of cysts occurring, such as the use of removable stitches that will cause less scarring and less healing of the skin. But to an extent, there's always a small possibility of a cyst occurring, and it's just important to bear in mind that these are quite treatable even after having surgery. I hope this information has been useful for you. Thank you for watching.